Hello and welcome to my lecture, Clinical Significance of Vitamin B12 Status Among Vegetarians. I have 5 different objectives of this presentation. Number 1, to identify individuals and groups at risk of vitamin B12 deficiency. And while doing so, I would like to clear some misconceptions about this particular issue. We will also look at what constitutes adequate vitamin B12 intake. We'll look at 2 separate recommendations and also some studies that give some light regarding this issue. We will look at the prevalence of vitamin B12 deficiency among vegetarians and potential and documented significance of the status of this vitamin in vegetarians, and finally we'll look at treatment options. Let's begin with who is at risk of vitamin B12 deficiency. And I would like to quote from the National Library of Medicine. The human body stores several years' worth of vitamin B12. So nutritional deficiency of this vitamin is extremely rare. Although people who follow a strict vegetarian diet and do not consume eggs or dairy products may require vitamin B12 supplements. There are actually at least 3 different misconceptions in this particular statement. And I actually contacted the Library of Medicine about this statement back in 2008, and I mentioned and explained the misconceptions, and they actually changed this or removed this statement, and I think changed it to a different one. And for years I have not seen this statement, but recently I have seen this statement again on this library, which is very unfortunate. I don't have time to elaborate on all the misconceptions, but it is a myth to believe that only a few vegans, as this quote implies, here and there develop vitamin B12 deficiency. And we'll look at some individuals and groups who are at risk. But first, let's read this statement that actually gives some light on this issue. Vitamin B12 deficiency and depletion are common in wealthy countries, particularly among the elderly, and are most prevalent in poorer populations around the world. This prevalence was underestimated in the past for several reasons, including the erroneous belief that deficiency is unlikely except in strict vegetarians or patients with pernicious anemia, and that it usually takes 20 years for stores of vitamin to become depleted. Does this sound like only a few vegans here and there might develop a deficiency? It was an erroneous belief that is still unfortunately propagated by this statement on the National Library of Medicine website. When we look at individuals and or groups at risk of deficiency and with documented deficiencies, we can list a number of them, and notice here these include all vegetarians, not just vegans, all vegetarians. That include semi-vegetarians, pesco-vegetarians, and lacto-ovo-vegetarians, and many of them develop a deficiency. I don't have time to discuss all of these groups, but you're welcome to pause the presentation and read all of these. What constitutes adequate vitamin B12 intake? Here I have 2 different recommendations. One by the Institute of Medicine from 1998, 2.4 micrograms per day for an adult, and a much newer one from 2014 by the European Food Safety Authority, 4 micrograms per day also for adults. Now, if we compare these two, there is actually 60, the European Food Safety Authority recommendation is actually 66% higher, okay? And I know of only one other nutrients for which the recommendation would change to such a big degree, and that is folate. In the past, the recommendation was 200 micrograms per day, and current recommendation is 400 micrograms per day. Now, if I was asked to set the recommendations, I would make it completely different. The recommendations would be based on age, perhaps also other factors. If we know that the elderly have a hard time absorbing vitamin B12, why would we set a recommendation for the elderly to be the same as a recommendation for young adults? And these recommendations are for all adults, that include young adults and also the elderly. Okay? So to me, this makes no sense, but this is what they are. And I also would like to point out something interesting. When we look at the rationale why or on what basis the Institute of Medicine issued its recommendation, we read the following. The recommended dietary allowance for vitamin B12 is based on the amount needed for the maintenance of hematological status and normal serum vitamin B12. This is very interesting because the Institute of Medicine also claims that serum vitamin B12 is not very sensitive marker of vitamin B12. And when we look at the hematological status, they don't necessarily refer to methylmalonic acid or holotranscobalamin. They are referring to mean corpuscular volume, which we know that in at least 1/3 of the patients, no matter how low vitamin B12, serum vitamin B12 becomes, there is no change in mean corpuscular volume. And we know that mean corpuscular volume is likely the least sensitive marker of vitamin B12 status, even though it may be very specific, because if we have elevated mean corpuscular volume, it is likely B12 deficiency. But in many cases, we will not know that there is a B12 deficiency based on mean corpuscular volume. Notice this and the next quote from two different studies. What constitute adequate intake based on relatively current research? In persons with normal absorption, our data indicate that an intake of 4 to 7 micrograms vitamin B12 per day is associated with an adequate vitamin B12 status, which suggests that the current RDA of 2.4 micrograms vitamin B12 per day might be inadequate for optimal biomarker status even in a healthy population between 18 and 50 years of age. And again, I want to emphasize they are talking here about a healthy population, young population with normal absorption. What if they included also the elderly? Okay, it would likely be higher, possibly much higher intake that is needed for maintenance of adequate vitamin B12 status. Here's another one. Daily vitamin B12 losses in apparently healthy adults and elderly probably range from 1.4 to 5.1 micrograms. Vitamin B12 intakes needed to compensate for these losses seem to range from 3.8 to 20.7 micrograms. As much as 20.7, that's 5 times higher than even the recommendation set by the European Food Safety Authority. Okay, and there are actually other studies that mentioned that perhaps even higher intake might be needed for some populations. Based on these findings, for sure the recommendation by the Institute of Medicine is inadequate. And I would like to point out that when we look at studies in which vegetarians had suboptimal intake, the intake was compared to which recommendations? It was compared to the IOM recommendations, which is vastly inadequate in my opinion. Vitamin B12 intake among vegetarians. Well, this is based on likely the best available data, which is from the Adventist Health Study 2. And they reported intake for non-vegetarian semi-pesco, lacto, or lacto-ovo rather, and strict vegetarians or vegans. And when we look at the median, it's actually somewhat high, we would think. But when we compare this median to the studies that we just read, and that documented how much B12 is actually, how much intake is actually needed, this is not necessarily very high. And furthermore, even if we take the median, meaning that the intake was relatively high, we have to remember that about 50% or so of participants here had lower intake, and the intake may be as low as less than 0.5 microgram per day, and for lacto vegetarians, 1.5 or so for about 5% or so of the lacto vegetarian studied. So the intake may be inadequate in a lot of people, and when we look even at this particular cohort, we know that the bulk of the cohort were people 50 years and older, which again may need much higher doses of vitamin B12. How prevalent is inadequate vitamin B12 status among vegetarians? And here I have data that I summarize in one of my publications. And when we look at these numbers, 75, 32, 43, 68, 83, and so on %. When we look further, we will find that somewhere between 20 to as high as 92% of vegetarians had inadequate vitamin B12 status. And so the prevalence of B12 deficiency is very high in all vegetarians. And when we look again at the populations here, lacto-vegetarians, lacto-ovo vegetarians, lacto-vegetarians, lacto-vegetarians, lacto-ovo vegetarians, and so on. And when we look at here, lacto-vegetarians and lacto-ovo vegetarians had 77% of them were deficient. It is not just in a few vegans, but the prevalence is very high and very widespread among all vegetarians. What constitutes adequate serum vitamin B12? And the reason why I focus on serum, even though it is not the most sensitive marker, is because this is the most common biomarker that is used in different studies and in clinical practice. This is again from the Institute of Medicine. The concentration of B12 in the serum or plasma reflects both the B12 intake and stores. The lower limit is considered to be approximately 120 to 180 picomoles per liter, okay, for adults, but varies with the method used and the laboratory conducting the analysis. And in most studies, when you look at studies, either 148 picomoles per liter, which equals to 200 picograms per milliliter, is used, and many laboratories in the United States and in other countries use these biomarkers. In fact, the one that is in a local hospital where I live use exactly 180 rather. Oops, sorry about that. Picograms per milliliter as a cutoff. Okay, and this is very unfortunate because we know, and I will show you some data, that individuals develop deficiency symptoms already at much higher serum vitamin B12 level. And notice here that already back in 94, Dr. Victor Herbert, suggested a different deficiency cutoff. Future study may show that the consideration of total serum vitamin B12 concentration less than 222 picomoles per liter or less than 300 picograms per milliliter is being subnormal, rather than the concentration of 148, which equals 200 picograms per milliliter, which is generally accepted today. Unfortunately, about or close to 25 years later, his suggestion is not really implemented in clinical practice. Notice yet another one. This is an editorial from the American Journal of Clinical Nutrition. It has become common practice to reassure those with serum vitamin B12 above the traditional cutoff for pernicious anemia, 148 picomoles per liter, that their vitamin B12 status is normal and so cannot be a cause of any observed cognitive impairment. This view can no longer be supported. There is abundant evidence that those with serum vitamin B12 concentrations in the so-called low normal range, that means 150 to 300 picomoles per liter, may, but not necessarily will, suffer cognitive impairment that can usually be corrected by vitamin B12 supplementation. And yet another one. Several large population studies have examined the relationship between plasma total homocysteine and methylmalonic acid to blood vitamin B12 concentrations. It has been found that the concentrations of these metabolic markers start to increase at vitamin B12 levels considerably above the typical cutoff value used to define B12 deficiency, which are the ones we mentioned, as can be seen from figure 1. And here's figure 1. And what these authors suggested is that plasma B12 of 400 may be much better marker of adequate intake, adequate status rather than anything lower than that. And in fact, again, we know from studies that problems such as cognitive decline, brain atrophy, and other issues increase, or these problems, the magnitude of these problems increase with plasma B12 being lower than 400 and maybe even slightly higher than that. What is the clinical significance of vitamin B12 status among vegetarians? And I would like to begin with cardiovascular disease. And the biggest impact on cardiovascular disease when it comes to vegetarians, B12 status has through the impact of homocysteine. And we know as serum vitamin B12 decreases, homocysteine increases. Okay? Although this is not the only mechanism, but this is the main mechanism. So I want to point out that. And so when we look at homocysteine specifically, notice each increase of 5 micromoles per liter in homocysteine level increases the risk of coronary heart disease events by approximately 20% independently of traditional coronary heart disease risk factors. And when we look at these traditional coronary heart disease risk factors, such as blood pressure and cholesterol level, especially LDL, and blood glucose control and weight status and others, we find that vegetarians, especially vegans, have improved profile of these in comparison to non-vegetarians. Does that mean that they don't have or they are not at risk of developing cardiovascular disease? Absolutely not. I met vegetarians and vegans who were on their diet since they were born. And when I talked to them, they were elderly. And they were after quadruple bypass, and they were after stroke, and so on. And why would that be? Well, one reason why is because homocysteine is an independent risk factor, and that means that one can have perfect cholesterol and wonderful control of blood glucose and not be overweight or obese and so on and so on. And it does not mean that one cannot have an increased risk of cardiovascular disease if one's B12 is low and homocysteine is elevated. Notice we have shown that risk of coronary artery disease is represented by a continuum of total homocysteine concentration, with substantial risk occurring between 10 and 15 micromoles per liter. And this is again very significant because oftentimes homocysteine equal to 15 micromoles per liter is used as normal. Well, it is not normal when we look at coronary artery disease risk based on what Jacobson here documented. And notice when we compare this is based on a meta-analysis, the only meta-analysis that is published that I know of homocysteine status in vegetarians. Okay, and notice that in this meta-analysis, vitamin B12, serum vitamin B12 close to or about 330 was needed to keep homocysteine at this critical level of 10 micromoles per liter. Now, when we look at what was B12 and homocysteine among vegans, it was about half that, or not quite maybe, but close to that. When we look at what it was among vegetarians, it was again vastly inadequate. But when we look at serum B12, 209 on average, and homocysteine considerably higher than the value of 10. I will not elaborate on this, but I in my publication, Is Vitamin B12 Deficiency a Risk Factor for Cardiovascular Disease in Vegetarians? You can read of a variety of different mechanisms why or how homocysteine detrimentally impact atherosclerosis and the vascular system. Another one is bone fractures, and we have actually studies that documented increased risk of bone fractures among vegetarians in comparison to non-vegetarians. Here is data based on the Framingham offspring study, and we find that individuals with highest homocysteine had 100% higher risk of fractures in comparison to those with the lowest homocysteine. And notice an interesting quote from the authors: an increased homocysteine level appears to be a strong and independent risk factor for osteoporotic fractures in older men and women. And so this is consistent with what we read in the context of cardiovascular disease. And this is data from the Rotterdam study. And again, we can see that as time progresses, those with highest homocysteine have elevated risk of fractures in comparison to those with the lowest ones. The meta-analysis showed that an increased documented an increased fracture risk of 4% per each increase in 1 mole per liter of homocysteine concentration. Similarly, there was a modest decrease in fracture risk of 4% per 50 picomoles increase in vitamin B12 level. Now, I want us to think about this for a little bit. So if we have an individual whose B12 is at the traditional cutoff for deficiency, 150 or so, versus an individual whose serum B12 is at 400, which was suggested by one of the studies that I included in this presentation, we would have 20% difference, not 4, but 20, because 4% for each 50 picomoles increase in serum vitamin B12 level. And so we will be then discussing a significant impact. And again, I will not elaborate much, but there is a variety of different mechanisms how homocysteine detrimentally impact the strength or the health of our bones. Brain atrophy is yet another issue that we need to discuss, and this is a very interesting study with 171 individuals who were elderly, who already had mild cognitive impairment, and they divided them into two groups, one of which received supplements of the B vitamins with the most significant impact on homocysteine, and the other were in the placebo group. So here we have an image or picture of the brain of a female participant who was 79, whose baseline homocysteine was 22 micromoles per liter, and it increased over a 2-year period by 8, and so at the end of the study was 30, and this individual had brain atrophy rate of 2.5% per year. In contrast, an individual, female individual who was 72, whose baseline homocysteine was virtually identical to the other individual, 24 versus 22, but because of the supplements that she received, likely because of that, her homocysteine was slashed by half. Notice at the end of the study, it was only 12 micromoles per liter. Brain atrophy rate was 0.46% versus, again, 2.5% in this individual. And when we look again at these images, notice that the blue and orange color shows atrophy. It's almost invisible for this individual, versus we can see a lot of these different changes here in the image of this individual. Again, when we calculate the difference in the brain atrophy rate, this individual here in the placebo group had 5.5 roughly higher or faster rate of atrophy in comparison to the individual from the active treatment group. Let's look at how to improve vitamin B12 status. A variety of different methods have been proposed, some of which are unreliable, while others are effective. And so the use of different algal supplements such as spirulina, nori, and others are unreliable depending on the studies. Some studies show that they don't contain any active vitamin B12 form. They all contain pseudocobalamins. Other studies show that there are some active forms. Regardless, even if we assume that we do have a reliable and active vitamin B12 compounds in these products, one would have to take doses that are not even advocated by manufacturers of these products in order to ingest adequate amount of B12 from these products. So these are definitely unreliable. Okay, probiotics, and there are a variety of different ones, and those that have been studied show that they make no difference, so they're not reliable. Nutritional yeast, when it's fortified, can be effective, but again, we would have to ingest adequate amounts of nutritional yeast on a daily basis. Okay, the most reliable are B12 supplements, assuming they are ingested in adequate doses, and B12 injections. Okay, and so when we look at reliable methods, the most reliable ones are vitamin B12 supplements and injections, and in the vast majority of the cases, a dose of 100 to 1000, depending on whether we are talking a child or adult or elderly participant or patient, was treated. And regardless of which form of B12 is used, the treatment efficacy seemed to be the same. So regardless of whether we use cyano, methyl, or hydroxycobalamin. There's actually an interesting advantage of using supplements versus injection. Number one, you don't have to see a physician, but more importantly, patients who are on what is called maintenance therapy, so they had deficiency, the deficiency was corrected, and then they see a physician or a nurse once a month and get an injection once a month. And they feel almost euphoric for a day or 2 or 3 after the injection, but then the impact of that injected B12 wears off, and toward the end, or a few days prior to the next injection, they feel progressively worse. You don't have these swings in the mood or in the way you feel when you routinely take vitamin B12 supplements. So this is actually a very interesting advantage over injection with using B12 supplements. And with that, I'm going to summarize. And so, again, the notion that just a few vegans develop B12 deficiency is completely incorrect. There are a number of others, including all types of vegetarians. Further, adequate B12 intake is very likely considerably higher than currently recommended, and at least for some individuals, especially if you are a vegetarian and likely have suboptimal intake, supplements may need to be utilized especially if you are elderly. Okay, normal serum vitamin B12 is considerably higher than the traditional cutoffs. Further, vitamin B12 deficiency among the vegetarians ranges from about 20 to as high as 92%, which is very, very high. And then B12 and hyperhomocystinemia are associated with a variety of different problems. And I actually included here even more than what we discussed, and that is cardiovascular disease, organic mental disorders, and that includes mood swings and bipolar issues and depression and things of that nature. And reliable vitamin B12 deficiency treatment options include B12 injections and B12 supplements. Now, if you would like more information, I have 2 options. Number 1, I have a book called Vitamin B12, Combating the Epidemic of Deficiency. And you are welcome to contact me if you would be interested in one. And another way is to go to my website, drromanpawlak.com, where there is more information on vitamin B12 and other nutrition and health information. And if you have any questions, you are welcome to go to my website and contact me using the contact information on my website. And I thank you for listening.